Thank you, everybody, for your patience on this. Good afternoon, everyone. I'd like to start with an apology for the delay. We had some technical issues over here that took about 15 minutes to resolve, but hopefully they have been resolved and we can get the meeting underway. Welcome, everyone, to the Allegheny County Board of Health meeting for May 5th, 2021. My name is Chris Tonieri. I am the Public Health Information Officer. Today's agenda will include a report from the Health Department Director, Dr. Deborah Bogan, as well as discussions on revisions to the Mon Valley Air Pollution Episode Rule and the Plumbing Code, plus a discussion on paid sick leave and other topics. So without further ado, I will hand the meeting over to Dr. Harrison.
Thank you very much. I just noticed there's a big lag between the phone and the live broadcast, which is going to make things awkward. So if by some chance the link for us becomes available during the meeting, if you could let us know and we'll regroup and do that. So I'm going to like to call the meeting to order. Probably ought to get a roll call. So could each board member please announce their presence and their name, please?
Bill Youngblood.
Edie Shapiro.
Ellen Stewart.
So Edie Shapiro, Ellen Stewart, thank you.
Don Burke.
Thanks, Don. Caroline, are you on?
Caroline Mitchell here.
Joyla Portlaw.
Tony Ferrero.
Tony?
Ferrero, I'm on.
Great. Okay, so we have 8 members present. So we had an executive session to discuss litigation and personnel matters. If I could get a motion to approve the minutes, please.
So moved.
Motion to approve. Second.
Any discussion? All in favor? Aye.
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 Opposed? Abstentions? So my interpretation is 8 in favor. Public comments on agenda items, and we're going to announce a change in the format. Todd, are you on?
Yes, Dr. Harrison, I'm on.
Okay, floor is yours.
Okay, just to confirm, I'm pretty good with voices, but it was Dr. Shapiro that made the motion and Dr. Stewart that seconded the motion to approve the minutes. Is that correct?
Correct.
Yes.
Okay, great. Thank you to both of you. Okay, now into the public comments on agenda items. It is important to note that each member of the Allegheny County Board of Health receives each written public comment and has had time to review them. I will summarize the public comments on agenda items. The Board of Health received comments from a total of 64 individuals. Of those individuals, 5 commented on the proposed Mon Valley Air Pollution Episode Rule. All of these commenters expressed concern for air quality and supported stricter regulations, including the proposed rule. The majority of comments, a total of 47, involved the proposed revisions to the plumbing code. All comments were in support of the proposed revisions to the section related to fixture counts, with 17 commenters expressing support for further loosening of regulations related to restroom facilities. 11 of the comments focused on the importance of the safety such regulations would provide. 5 of the commenters talked about how these changes would benefit businesses. 12 commenters explained these changes would also benefit caregivers and parents. 12 individuals commented on the proposed formulation of Article 24, paid sick leave. All the comments supported the proposed regulation. Several individuals described how this regulation would enable them to care for family members. And that's the end of the summary, Dr. Harrison.
Thank you very much, Todd. Okay, so we are going to move into old business, and we're going to start with a COVID update. And please recall that we do have a lag between the video and the audio. Dr. Bogan?
Great. Can someone load my slides, please? Thank you. Next slide. So I'm going to keep my comments very brief today. I'm going to give a very brief update on COVID-19 cases status here in the county, as well as vaccination efforts. A very brief update on our air quality dashboard and some personnel updates. So this is a snapshot of our county COVID dashboard, the top part of it, where we provide overall cases, individuals tested, positivity rate, hospitalizations, and deaths across the entire pandemic. And as you can see, we've had almost 100,000 reported cases of COVID-19 in the county, and about half the individuals in the county have been tested at least once. Because we have 540,000 people tested and we have 1.2 million people here. So it's close to half have been tested at least once for COVID-19. In the second box below, we have our 7-day moving averages of cases, tests, positivity, hospitalizations, and death. And this has a lag by a week to make sure that the data are as complete as possible. So you can see our 7-day moving average cases is about 260 still, and our positivity rate is been about 5.5%. That is for PCR tests, not for all tests. And you can find that. I put the link to the website at the bottom of the page. So this is the top half of the dashboard, the next section. And this is a snapshot of the bottom half of that dashboard, which shows our weekly data and trends for cases, individuals tested, hospitalizations, and deaths. And I don't know, up in the upper right-hand corner, you can see it says time period, and I've selected all, but you can pull that menu down and you can change it to 3 months or 6 months as well, so you can see things in more detail. But this is weekly trends, and after a year of data, it got very hard to see daily amount, and we thought it was easier to really appreciate the trends we were seeing looking at week at a time. So we made that change to the dashboard a while ago. And as you can see, by cases and hospitalizations and deaths, that we really had sort of 4 waves. Our initial early wave, followed by a summer surge, followed by a winter big surge, and then again a small but significant surge that we're still in right now in late winter, early spring. And I just want to point out a couple of things. Our deaths were most prevalent in the November, December, January, but we are seeing ongoing deaths in our community from COVID-19. So we're not completely free of that. And we've also had a significant number of hospitalizations this spring as well. Next slide. So I'm switching from the county dashboard now to this Pennsylvania COVID-19 early warning monitoring dashboard. And this is the second page of their dashboard. And I've selected, as you can see at the top, I've selected Allegheny County. So this is data for our county that the state puts out and updates. So you can see, according to the state, we have a decline in our newly reported confirmed cases. Our incident rate is going down slowly. Our PCR positivity rate is falling slowly, as are all of the other variables, except for emergency department visits due to COVID-like illness, but that really went from 0.4 to 0.5, so hard to interpret those small changes here. Next slide. And again, this is from the state COVID-19 vaccine dashboard. And so we have now been offering vaccines since the end of December in the county and in the state. And the state puts out data both about vaccines administered and individuals vaccinated. So this graph on the right-hand side shows our daily number of vaccinations administered by date, including those who are partially vaccinated or fully vaccinated in the different colors. And as you can see, we reached a peak of vaccination days sort of in the end of March, beginning of April. And we've been trailing off a bit. We're still vaccinating quite a few people, but not quite to the rates we were a couple of weeks ago. We have so far vaccinated, partially or fully, 678,000 individuals in the county so far. So again, we have a ways to go. We have 1.2 million. Not all 1.2 million are currently eligible for the vaccine because we currently only have vaccine approved through 16 and up, so we don't include children younger than 16. So if you estimate about 1 million people who are eligible, we still have a couple 100,000 to go to vaccinate everyone in our county. But it's helpful to keep an eye on these numbers, and we do that every day. Next slide. So the Allegheny County Health Department, I think I mentioned this at our last Board of Health meeting, we only receive about 10% of the doses of vaccine that come into the county. We at the County Health Department have given about 110,000 doses at this point in a variety of settings. We've had large center clinics going on for quite a while, like Castle Shannon, at Ross and Monroeville. Our Monroeville site is now closed, but it was where we started. We have smaller sites at Central Baptist in the Hill District and Bethlehem Baptist in McKeesport. And then we have our very small site where we use our Hartley Rose building, where our immunization and pulmonary clinics are located downtown. We've used that as well. We've done a lot of work in senior living facilities along with others in the community, and also senior centers. And we've had a lot of community-led events. But as vaccine, I think we're pretty much close to done with large vaccination events in the community, and we're really switching and pivoting our efforts, and I know lots of people are switching to sort of small community events and mobile van services to really try to reach everyone in the county. We have a couple of remaining challenges related to vaccines. We have ongoing issues with equity, and that challenge is made a little bit more difficult because we don't have all of the county data for vaccination. So the state puts out the information on their website about the numbers of vaccines, but we don't have it to the community level. And without that, it's hard to know where we should be putting our efforts. So we're still working on getting that data. But lots of organizations are working to get vaccine out. We have pharmacies, federally qualified health centers, doctors' offices, lots of people really working, every health care organization, our health plans. This is really all hands on deck, people working to get vaccines out into the community. We have been mapping locations of where people are providing vaccines and continue to work on public messaging. Accessing vaccine has been a challenge, but definitely way improved. We've had our collaboration with 211 now for quite a long time. United Way takes our calls and helps people register for vaccines, and also takes information about those who need home vaccine in their homes, and working on getting systems out to address that. Our new registration system is working quite well, and we've had walk-up events, so all of our sites have been accepting walk-ups for close to 2 weeks now. And again, we get some walk-ups, but again, we'll be working on more access issues over time. And we have a vaccine map, which I'll show you. And then, like everyone in the country, we're talking about vaccine hesitancy, but I really think we need to be reframing that as vaccine confidence, because we have millions and millions of people who've been vaccinated in our country very safely, and around the world. So that, I think, is a discussion we need to have. And then really, one of the challenges is that when you ask people who they trust and who they will listen to about their vaccination recommendations, people trust their own doctors. And right now, the way the vaccines are packaged in multi-dose vials, it has been challenging because individual doctors' offices may not have enough people coming in a day to accept who need the vaccine, and so you wind up doing a lot of waste. But I do think that is going forward, we need to really think about how we distribute vaccines into doctors' offices, because that's where people want to go and that's who people trust. So that's not just a challenge here, that's a challenge across the country. Next slide. I just wanted to share two pieces of information. One is our map of our senior buildings. So we worked with vaccine providers across the county with the help of our county stat program they developed, and our Department of Human Services. We have a map, we map all of the senior buildings in the county. And as people signed up and brought vaccines to those senior buildings, we changed the color. So the gray dots on this 174 senior buildings in the county, the gray ones are completely done. The yellow dots are meaning they're in progress. Some of those we think are done, but we haven't gotten callbacks from all the organizations that signed up or from the building itself. And the blue ones are awaiting, but we've called every single one of those buildings and offered vaccine to be delivered there. and we haven't gotten any more requests. So we think we're done, which is pretty amazing. And not just the health department, but many community organizations participated in this work. So this was not just a health department effort, it was a community-wide effort. So thank you for all who helped reach our seniors in these senior buildings. We also have a map of vaccine clinics, which include pop-up events. And so I put the URL for that at the bottom, alleghenycounty.us/vaccine map. And that is continually updated with new information. Next slide. I'm sure you've all heard that on May 31st, on Memorial Day, Pennsylvania will lift all its mitigation orders except masking. I want to remind people that we still have about 250 cases a day, and we have many people who are not yet vaccinated. So I want people to think very carefully to use all the information we've garnered over the last 15 months in our experience with COVID to really individualize behavior within your businesses, your community. Not all, this isn't going to be a one size fits all. You really have to consider risk levels of your experiences, who comes to your buildings, who comes to your organizations, and what that looks like to really make some determination of how you will use that information. I've heard some concern that people think COVID is over as of May 31st, but again, our case numbers suggest that that's not the case. And, we still had over 70 deaths in the month of April due to COVID-19. So we are not completely done. So this order needs to be taken in context of the pandemic and where we are, but all the information we've learned about how to manage and to be safe. And the more people we have vaccinated, the easier this becomes. So put that in your minds to think about. Next slide. Switching topics from COVID to our air quality dashboard. As you know, in early April, we updated our air quality dashboard to give it plainer language, to make it more accessible for people. We also wanted our dashboard to reflect the air quality indexes that are set by the EPA. So for instance, the PM 2.5 air quality index is a 24-hour measure, ozone is 8 hours, and SO2 is 1 hour. And so our new dashboard reflects that, although all of the data are available. Unfortunately, we had to take that new dashboard offline about 10 days ago. I will tell you for sure that the monitors are out there and working and collecting data, so the monitors are working. The issue was really a disconnect between the data being pulled from the monitors to the dashboard and one of our vendors and how the data are pulled. This is really a software issue. And so our air quality monitoring hourly readings continue to be provided to the Western Pennsylvania Regional Data Center website, and we are working as fast as we can to get our dashboard up and running. So I apologize that it has been down, but I can tell you all hands on deck are working to address the software challenges. Next slide. Just wanted to announce some staffing changes to the health department. We hired a health equity coordinator, Cal Wilkinson, joined us, I want to say about 2 months ago. So I want to welcome Cal to us. Cal was supported by a grant from the Public Health Improvement Fund for the first year of their work here. And we have a new Public Health Information Officer, Chris Tigneri, who introduced the meeting. Mike Parker, our longtime solicitor at the health department, left a few months ago. We've had Jeff Bailey doing an amazing job as our acting solicitor, but we have made an offer for to fill that position permanently, and we are waiting to make that announcement until all things are signed and finalized. We also have lots of posted positions out there, including our human resources manager, a deputy of clinical services, environmental health communication specialists, inspectors, housing, plumbing, and food, and public health nurses. So this is a shameless plug to all of you listening to go to our website, and if you're qualified and interested in positions at the health department, we're always looking for wonderful new talent to bring into the health department. Next slide. And with that, I leave with some images from the CDC communications package that's on the website at the CDC, including masking, protecting yourself during travel, promoting vaccines, and also mental health issues that have been made even more prevalent as a result of our COVID pandemic for the last 14 months. So those are my comments. I'm happy to answer any questions.
Thanks, Deb. Before we get to that, I'm fine. There's a very long lag between the live event and the audio that we have via phone. I'm finding it much easier to follow the slides by pulling up that big 5 megabyte packet that we got, so you can be in sync with the audio. Any questions or comments for Dr. Bogan? Okay, thanks very much. So we have 5 items of new business, and just to be clear, each one of them is going to require a vote from the Board of Health. So we have, looks like Mr. Jim Kelly has a run of 3 presentations. So Jim, do you want to take it away?
Thank you. Good afternoon. Our first item up for a vote, and this is actually 2 regulation changes. Actually, one is a new regulation, and one is a revision of an existing regulation. And this is to go to public comment. Next slide, please. So I think we're all aware that Allegheny County is afflicted with certain meteorological conditions that result in conditions that are conducive for poor air quality. And what this slide shows here are what happens when we have those conditions. We're talking about the 24-hour PM 2.5 standard. That's the daily standard. And if you look at the first line here, any exceedance day, you see what happens anytime we have an exceedance in the county, and it's going to be at Liberty. This is what the other monitors look like. So it shows that there's quite a differential there. There's a significant emissions gradient that's happening at Liberty. And when we have these conditions that happen for multiple days, you'll see there again, the Liberty monitor, the average is 48.7, whereas all of those other values seen across the other monitors in the county are well below the standard. And again, remember, the standard here is 35 micrograms per cubic meter. So you see what's happening here is we have a problem with our Mon Valley monitor, our Liberty. And so considering issues with pollution episodes, we are proposing this rule. Next slide, please. So what this rule is going to include, it's going to include a watch. And this watch happens when the next day's air quality is forecasted to exceed the PM threshold. And that threshold is 35 micrograms per cubic meter. And I'll tell you about what is required when that watch happens. The second part is the pollution warning. So if we've exceeded that value and the weather conditions are expected to remain such that we will continue to exceed that, then we're going to go into a warning. So let me give you a little more background information. Go to the next slide, please. So this is the area we're looking at. This is the Mon Valley. Mon Valley is an area that is heavy in industrial facilities. Our previous modeling has demonstrated that this is the area, this is the list of all the boroughs in this area that affect the pollution conditions in the Mon Valley. Next slide, please. And this episode rule will apply to, it's specific to industry in all major and synthetic minor sources of PM 2.5. Now, a major source is any source that emits pollution of 100 tons or more. That's the potential to emit. A synthetic minor is if they have the potential to emit that, and they've taken some limitations to keep them below that threshold of 100 tons. Now, all the sources that have a combined allowable emission of 6.5 tons per year or more of PM 2.5 and 10 tons per year of PM 10, that's the threshold that we're looking at to include facilities in this rule. And the reason, the relationship between 6.5 and 10, that's typically when we only have data for PM 10 from a facility, typically 60 to 70% of that PM 10 will be 2.5. And so that's the difference between the two numbers there. Next slide, please. So the air quality forecast that leads us into this this episode rule, currently our forecasts are provided by the Pennsylvania Department of Environmental Protection. They provide that in the afternoon prior to the day, usually about 4 o'clock. anyone can go online to see that from the state's resources. The second part here is we want to keep it open if we're looking into additional opportunities, and so maybe we can hire a third person, maybe we can onboard some capability to maybe improve that forecast or refine it a bit. So while we're currently using the EP's forecast, we want to give ourselves the option to improve that in the future based upon the director's approval. And again, if we make any changes to how we go about this forecasting program, the methodology will be posted on our website. Next slide, please. So this is the industry that I identified before. Those thresholds of 6.5 tons per year of PM2.5 and 10 tons of PM10. What this shows is each one of those red dot is a percentage of the total PM2.5% as a total. You'll notice some of those areas have multiple rings. That means there are co-located sources on those facilities. And so that can actually make the emissions from that facility a little bit higher. This next slide, please. It's a similar graphic showing the PM10 as part of the total. And you'll see they're very, very similar between the two, because again, one is about 65% of the other. Next slide, please. These are the specific industries that we've cited in this rule. The industry at the top, those where we have very good emissions data that is specific to PM2.5, and the facilities, the smaller facilities below, are the emissions data we have tend to be only in PM2.10. But this is the list of all the facilities that will be involved when we have any types of alerts used by this rule. Next slide, please. Okay, now here's what's really important about this. So when we have that watch or we have that warning, this rule will require facilities to submit a plan, and the plan has to have two phases. The first phase is if we would issue a watch, and a watch means when we are expected to exceed the standard, the facilities basically have to gear up and prepare possibly for a warning. They have to make sure all their equipment is operating with good engineering practice and maintaining good working order. It kind of puts them on notice, means to expect if these conditions continue, we'll get to the next phase. So if we've gone past a watch, we're into a warning. A warning means we've exceeded that standard and those weather conditions are continued to be such that we will continue. That means the facility has to implement their mitigation plan. The mitigation plan, the rule itself specifies certain things that they have to do. They submit our plans to ACHD for approval. And so once this warning happens, then the plan happens. They have to take measures, try to reduce the emissions as much as possible, proportionate to their contribution. Next slide, please. Now, the dates for submission of the plans, once this rule is effective, and it will be effective if this board passes the rule and county council approves of the rule as well. After that effective date, facilities have to submit their mitigation plans. Now, if we have a new source that starts up after the date of that effective date, then they need to have a plan on deck. They need to submit. It's like you build a brand new factory, they have to, when they get their permit, they actually have to have that plan in place with their permit. This third part, suppose we have an existing facility here that makes changes to their operations that make them subject to this rule, then they have 90 days to submit that plan. Next slide, please. Here's the notification phase of that. So this is really what's important. This lets everybody know that we've issued a watch or a warning. We're going to use Allegheny alerts for this. We notify the sources to implement the procedures and measures, identify the plan. So we notify the industrial sources. Next, we notify the municipalities to make sure that they are aware this plan is in effect, because there's another portion of this that affects them as well. Then we issue an advisory on our website, we notify the media, and then we issue an Allegheny alert for those people who are signed up for this specific Mon Valley episode alert requirement with Allegheny alerts. Now, the termination, the department shall issue a notification when it has determined that the air pollution watch or warning is no longer in effect, and it can typically be as soon as 24 hours after the issuance of a watch or a warning. Next slide, please. Now, here's the second part we're asking for approval. And so the first part is the new rule, it's the episode plan. And the second part is open burning. So what happens when we notify those municipalities, when we are in a watch or a warning, this is basically an air quality action date for the Mon Valley. This requires that open burning activities will not be conducted during these days. And so we're trying to dovetail these two parts of the rule together. We're issuing warnings and watches to the industry, and then we're also letting the municipalities know that we're in place, and then there's basically an open burning ban in effect until the watch or warning is terminated. Next slide, please. So what we're requesting approval to go to public comment for these two rules that I identified. The first rule is 2106.06, the Mon Valley Air Pollution Episode, which is a new rule, and then 2105.50, open burning. We're requesting a vote to go to public comment, please.
Okay, thank you very much. Any questions or comments?
This is Joylette. I just wanted to say thanks to Jim for that helpful review of this new regulation. I am very happy to see this effort made to both figure out some effective strategy for helping to mitigate pollution at the times when the air quality is most impaired, and also to identify the specific areas and really look at kind of this airshed approach to how can we make sure we're improving the air in the places where that's most needed. So I like the continuation of that. I did have a question for you, just to clarify. So this would be a new regulation. So if these plans are not submitted or they're not put into place, that is subject to enforcement then by the department?
That is correct. The rule requires these facilities identified by the rule to submit plans. Mitigation plans, yes.
Okay.
Any other questions or comments? Okay, can I have a motion regarding going to public comment, please?
I'll make a motion that this goes to public comment.
Okay, thank you, Ellen. A second?
I'll second. It's Edie.
Thanks, Edie. Any additional questions or comments? All in favor? Aye.
Aye.
Opposed? Abstentions? Okay, thanks. Todd, was that all clear?
Yes, it was. I had Ellen as moving the motion, Edie seconding it, and the motion being approved unanimously.
Okay, thanks. So, Jim, your second, the Clean Air Fund request?
Okay, I'll wait till there we go. So this is an integral part of what we just requested. So now you've approved for us to move on to public comment with the air pollution episode rule. This next part is important to that because as I mentioned before, a lot of this rests on the use of Allegheny alerts. Right now, we obviously have Allegheny alerts for the municipalities for the industry, but for the people affected in this area, well, we don't have a very good list there. And so this is a Clean Air Fund request where we're requesting funds. Next slide, please. So the goal is, for this rule is to reach as many people as possible, encourage residents and communities to sign up using Allegheny alerts. Hopefully we'll be able to achieve this through next year. The plan elements, we're requesting $200,000. It will be an open competitive request for proposals. And we hope to receive multiple proposals from multiple groups. And obviously we have an in-house evaluation process with criteria to approve those requests. Next slide, please. So again, you saw this slide earlier. This is the area that we are focusing on. Now, this is the primary goal of this request, but it's not going to exclude other people from across the county from being signed up. But for those groups that are interested in getting a higher score, this is the area that we are focusing on right now. These are the areas located in the Mon Valley episode rule. Next slide, please. So, and then this is part of the outreach plan. A request for proposals will be issued. Nonprofits and any organizations, they can sign up. They can reach out. They can request money for this project, and they can be approved. Purposes of participation in Allegheny alert system. We will score, we reward grants based on the ability to sign up as many people as possible through Allegheny Alerts. We do encourage public participation and our community health assessment for the health department. Another part of this is the awardees are required to collaborate with each other. The purpose of that is so everybody, no duplication. So we want to avoid that. And so if we have several groups working in the same area, citing different populations, we want to make sure all that is coordinated to make sure that we are not inefficient in reaching the goals of this plan. Next slide, please. So here's the schedule. This is an optimistic schedule. We want to request proposals by mid-May, early 2021. We'll score those projects sometime in mid-June. Contracts issued throughout June at the earliest. Outreach will begin later this summer, and they are to take place the first quarter of 2022. Ongoing evaluation by comparison or increase in subscribers from targeted zip codes. So we have that ability. Remember when I said coordination? And so obviously we're going to see people signing up, and so we'll have that ability to give feedback on the success of projects as they're ongoing. Next slide, please. So we are requesting the board to approve this Clean Air Fund request of $200,000 for community outreach for the use of Allegheny Alerts.
Okay, thanks. Any questions or comments? If not, can I have a motion, please?
Motion to approve.
Second.
Thanks, Joylette.
It's
Is that-
Ellen.
Ellen? Thank you. Any additional discussion? All in
Just,
favor? Aye.
Excuse me.
Go ahead.
Yeah,
Aye.
just is the expectation is that there are existing apps like this around the country that are adaptable to Allegheny County and that will just be taking some that's already preformed?
No, this is specific to Allegheny Alerts. We do have our Allegheny Alerts, which is here in Allegheny County.
But I meant the underlying software. I assume there are packages like this elsewhere.
I'm not aware of the packages used elsewhere, but we have a software package that supports our use of Allegheny Alerts. And I know that that software is used in other areas. There may be similar things in other areas, but we depend on Allegheny Alerts to sign up our population for all.
Any other discussion? Okay, all in favor? Aye.
Aye.
Opposed? Abstentions? Okay, Jim, your grand finale is the PM10 second maintenance plan?
Yes. Okay, so this is something that we had brought before this board previously to the public comment. And so this is what we're looking for, is final approval of a limited maintenance plan for PM10. I want to make sure we note this is for PM10. This is a standard we have attained for over 20 years. And we're in the maintenance portion of it, which basically means we have to maintain that area before we can move on to attainment. And so this plan is part of that. Go to the next slide, please. Okay, so this is the timeline for PM10. You know, the Liberty area was our non-attainment area. It was designated non-attainment in 1990 based on the NACs just previously before that. We submitted a designation attainment SIP in 1993. That's how long we have been dealing with this issue for PM10 in this area. The redesignation request initial maintenance plan was approved in 2003. And so what that means is we submit that maintenance attainment plan. We actually attained. Then when we attained, we submitted a plan for maintenance. That was the very first plan. When you have data that shows you're attaining the NACs, in this place is the PM10 standard. Once you attain it, you submit to EPA a plan for 10 years to show you're going to maintain that. And then after that 10 years, you submit a second plan, and that's where we are right now. This is our second plan. It's part of that showing you're keeping those values below the EPA standard for 20 years. And so this plan will will show continued maintenance through 2023. And this is a limited maintenance plan, and I'll get into more about what that means a little bit later. So next slide, please. So this is the area. So PM10 is a very localized impact. It is what we call primary PM. It comes directly out of the smokestacks. It's heavier, so it doesn't travel as far. We have these 5 municipalities. It affected only 4 industrial sources. We do have a lot of monitoring in this area: Lincoln, Liberty, Glassport, and Clairton. Next slide, please. So what a maintenance plan requires, it requires an attainment inventory. So the plan has to have an emission inventory of all the data from all the sources in the area, and we have to show that that was below the value that we attained long ago. A maintenance demonstration, which actually includes all of these things, that we maintain our monitoring network, we have plans that we failed to meet the standard, and then all of those Clean Air Act requirements that we put in place will stay in our rules. Next slide, please. So this is the emissions inventory right now. This is what we call our attainment inventory. These are a lot of numbers, but these show you the overall values for attainment in this area. This is a big part of the plan. We show these values, and they are all below the emissions that we used in 2003. Next slide, please. And so here's the monitored data. Now, the difference between the slides on the left and the right. So the slide on the left has 2 things that are different from the right. One is those are the annual values. That's those annual maximum values for each year. That red line at the top, 150, is the standard that we met, 150 micrograms per cubic meter. Now the slide on the right is the design value. If you recall, I said before, a design value is, to meet an EPA standard, they are 3-year values. And so where we are right now is the last 3 years before us. And this plan was prepared before we had the 2020 data. So it's 2017 to 2019, that's our design value. Now you'll see that broken line there at the bottom. That's 98 micrograms per cubic meter. And that means we can submit a limited maintenance plan that doesn't have as extensive criteria as a full maintenance plan, because we are so far below the standard. Remember that broken red line is 98, the standard is actually 150. So that allows us this limited maintenance plan. Next slide, please. So again, these are elements for a limited maintenance plan. We have to show that the monitoring network that was in place when we were not attaining is still there. We have a contingency plan. If we fail to meet that standard, then those contingency measures have to be enacted. All those other SIP requirements, the Clean Air Act has certain administrative and other criteria you have to adopt when an area fails to meet attainment. All of our SIP controls, and SIP controls are all those rules and regulations that we put in place to get us there. And so a lot of those rules have adopted Clean Air Act requirements for things like permitting and modeling. Next slide, please. So this is what happens. Like I said, we first got that first attainment plan in 2003. We have to have 2 10-year plans. We have to maintain maintenance. That's why it's called maintenance. Everything is kept in place for 20 years to show attainment. So while the data we have shows that the data is meeting attainment, it's EPA classifies it as maintenance, and then after 2023, if the monitor values are still below that, then we actually become attainment for the first time in the history of our county for PM10. And so again, I want to point out that monitoring will continue, so the monitoring is not going away. Next slide, please. So our public comment period, we had that early in January through March. We had a virtual public hearing, no one testified. We did not receive a lot of comments. We had 1 individual, 2 organizations. Now the comments weren't really germane to the plan. Some people did point out that more emission reductions were needed because of COVID, because obviously 2020, because of reduced travel and reduced industrial activity, we did have our emissions data and monitor data were a lot lower than normal. And other people commented that the department should support EPA adopting more stringent PM 2.5 and 10 standards. And then another comment was that the Allegheny County Health Department should pursue more health protective standards. Now, since this plan is not requiring, it doesn't require new requirements. It's not setting new rules. All it is showing is everything that we've done in the past is being kept in place going forward. So there really isn't much to respond to these comments, because these are requesting the health department to go beyond what is required by this plan. Next slide, please. So we are requesting approval of this plan. This is final approval. If this board approves this plan, we submit it to the Pennsylvania Department of Environmental Protection. because only states can submit the final SIP to EPA, and we are a local agency, so we have to submit to PADEP. They make sure that we're consistent with their requirements, and then they submit to EPA for final approval. And so here we're asking for a vote for final approval of this plan to begin this process to submit to EPA.
Okay, thanks very much, Jim. Okay, let's open it up for discussion. Questions, comments?
Thanks, Jim. I'm wondering, can you talk a little bit about, because this comes up often, what is EPA's process for setting these limits? And are there points where the health department has input into that process or not? My understanding is that our input into the process is relatively limited, but I wanted to just hear a little more information on how that process works.
Okay, so Dr. Portlack, you're asking specifically how EPA sets their health-based standards that we call the National Ambient Air Quality Standards. Is that what you're asking?
Yes.
Okay.
Yes.
All right, so that's a lengthy process. So EPA has to review and determine if they need to revive those standards every 5 years, and there are 6 of them. They're all the criteria pollutants. Obviously, the ones that are most concerned to Allegheny County are PM 2.5, which is our most persistent problem, ozone, as well as SO2. And so the Clean Air Act requires CASAC, the Clean Air Scientific Committee, to review these, and they are made up of national experts, and they are politically important, and so they represent anywhere from scientists, modelers, epidemiologists, and some industry representatives. And they are supposed to be the expertise that makes the final judgment. Now, behind them, there tends to be quite a vast support group. There are subcommittees for each one of these. I actually personally know people on CASAC and subcommittees that I work with. There are subcommittees that do a lot of the heavy lifting. They do a lot of the literature review. They do a lot of the modeling review, the science review, and they do that. And I know in the past there was an executive group from the White House. It was basically PM 2.5 advisory force, which was the previous administration had basically disbanded that, and now they're putting them back together. But so you have this vast group of experts that they have to comb through the vast amount of information, scientific studies, the best available science. Typically, EPA can't even get that done if they have all the pieces in place in 5 years, because those of us who know, EPA misses those and then they're sued. They have to settle to get those standards out as soon as possible. And so, and these are national experts in all these fields. And so you're asking, how can Health Department help with that? Well, we fully support EPA reviewing these standards and setting these new standards based on the best available science. Our expertise in-house probably isn't sufficient enough to go beyond the expertise that already should be on board to help EPA with the approval process with the committees, the subcommittees, the advisory groups. So the best thing that we can do is make sure that we support EPA's efforts to continue the reviews and make these standards as protective as public health as possible. Does that help you understand the process and the possibility for the health department to help with that process?
Yeah, I think that was helpful. I guess so. It sounds like apart from participating on these subcommittees, and are there other places where we can express that support for the standards to be as protective as possible?
Yeah, I'm not really sure. I know the subcommittees are also appointed, and I think they're appointed by their peers, because the subcommittees, like I said, they do the heavy lifting. They are the true experts, and they tend to be beyond political appointees. And so there's the people. It's kind of like the law clerks sometimes. They're putting everything together with CASAC, with their can review those. And so again, I'm trying to think how best the health department can support those efforts, because we don't have anything that's specific. We don't have the research in-house that is specific to the evolving science on the edge of where those standards need to be. But I think that's something that going forward that we probably should try to explore any way that we can possibly help with whatever resources that we have to offer. something that's worth exploring.
Okay, any other discussion? Okay, can I have a vote, please? I'm sorry, not a motion.
I'll move it.
So this is a motion to approve, approve the plan. Any further discussion? I'm sorry, who, actually, probably when we speak, we probably ought to say who's who, just so.
Bill Youngblood, I'll move.
And who was the second?
Ellen Stewart.
Thank you. Any further discussion? Okay, all in favor, aye.
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 Opposed? Abstentions? Okay, thanks very much, Jim. Okay, so Mr. I'm sorry?
I said thank you.
Oh, thanks. And then Mr. Jeff Bailey is going to talk about revisions to Article 15.
Yes, thank you. Can everyone hear me all right?
Yeah, your
Thank you.
Are very good.
Yes, my name is Jeff Bailey, and I'm the acting solicitor for the health department. And I, as Dr. Bogan mentioned, that we will be, they've selected a new solicitor to replace Mike Parker. And I just want to thank Dr. Bogan and the board for allowing me to serve in this position for the past couple months. And I'm really looking forward to working with our new solicitor. So I'm going to be presenting
we
today.
We appreciate your service, yep.
Thank you. And so I will be presenting today on the plumbing code regulations that we're proposing. Now, before discussing the changes, I think it might be helpful to provide some background and context to the plumbing regulations. So there's what's called the International Plumbing Code, which is a model code, and that's updated every 3 years. Now, Pennsylvania law provides that the state is to adopt that code and then consider adopting updated versions of the code as it is revised. Now, the law also allows the Allegheny County Health Department to adopt its own plumbing code as long as it meets the minimum requirements of the version of the IPC adopted by the state. Now, what I want to emphasize is we cannot be less stringent than the IPC adopted by the state, but we are allowed to be more stringent, and which we are in some areas relating to the number of required fixtures. Now, we received comments from the community requesting that we adopt the 2021 International Plumbing Code. Now, it's important to mention that the state has only adopted the 2015 IPC. There's also 2018 and a 2021 IPC, but the state is currently reviewing the 2018 IPC, but that has not been adopted. So we are still required to meet the minimum requirements of the 2015 IPC. Now, the 2015 IPC sets minimum fixture requirements, which we are required to follow. Fixture requirements mean it says how many bathrooms, either male or female, are required, that a business is required to have. But there are, as I mentioned, there are some places in our regulations where our fixture requirement is actually more stringent than what's in the 2015 IPC, and where our regulations require more fixtures. That gives us some flexibility on the use of those, which is part of the regulation change that I'll be discussing. Now, a little bit of history, and I quickly here is, as you may recall, this in 2018, the Board of Health approved changes to Article 15, and that was presented to the County Council, and they started their initial review. But during that process, the state then adopted the 2015 IPC during that. So it was decided at that point not to move forward with the plumbing code revisions, and then to start adopting the 2015 IPC. So at this past November in 2020, we presented to the board here revised regulations that were intended to be consistent with the 2015 IPC, and the board approved those this past November. Now, before submitting them to the County Council, we did do a review of those changes because there was a significant number of changes, as you may recall. And we wanted to be ensured that we're not only that we're also consistent with the 2015 IPC. We also wanted to see if there was maybe some potential flexibility with regard to the fixture use, as been requested by members of the community. Now, based on this review, we are proposing 4 changes. Could you, next slide, please?
And can you say which number you're on, which slide number you're on? please.
This is slide 46. That's the number on the page.
That's of the whole slide deck that you got sent, the PDF page.
Yeah, I've got it. They're numbered 1 through whatever, so it's hard to. Those numbers don't correspond. Okay.
I just one second. I could probably find it here for you. So I'm now on page, looks like 115, where it says requesting recommendation to submit.
Yeah.
So we are
slide number 3 in the slide deck. Yeah. Right.
Yeah. So we are requesting to make several changes. Now, I do want to note that the Plumbing Advisory Board did meet last month and reviews these proposed changes and did not vote to recommend these changes. Now, the board did receive a letter from the Plumbing Advisory Board, and as that letter sent to the board indicates that they did support the changes to the plumbing fixtures, but did not support the revisions related to section 106.4, which is relating to the site work. Now, I'll go ahead and discuss some of these specific changes. Can you go to the next slide, Todd? And I apologize, I think the board might be seeing, if you're looking at the packet, I think the slides got changed a little bit, so you might be looking at, it'd be page 114 or slide 2 of the packet of the presentation where it says section AC 106.4.2 site work.
Yeah, so that's slide 4. It
was
looks like at the bottom right-hand corner of the slide deck.
So the first change we're proposing is to this section 106.4.2. And as part of the 2020 draft that was sent to the Board of Health, we proposed to amend language that required site work at commercial and industrial projects to only be performed by licensed plumbers. Now, this change was not part of the IPC 2015 revisions. And as we reviewed this, we decided in order to be consistent with the IPC, we are proposing to remove the proposed changes and to keep the section as it currently states in Article 15. Next slide. And if you see in your packet, there's the regulatory language for 106.4. Number 2, and it should be in, you'll see some red. Now, what's in red to explain what this is so the language that is bold red and that has strike through, that was language that was initially proposed to the Board of Health back in November. That was a new language that we were going to add to this section. And again, this was not part of the IPC 2015. The language that is only in red, that was language that was intended to be, that was originally indicated to be deleted. And what we're proposing to do is keep it exactly as it is currently now in terms of how it's currently in Article 15, and just keep the language the same. And so to address it for the purpose of consistency with with the IPC 2015. Next slide, please.
Jeff, before you go,
sure.
If I understood you right, that last slide, is that line, the bottom line, the installation of site work, et cetera, is that in or is that out?
That is language that will be out. That language is currently not in our regulation. We were proposing in November 2020 as part of the revisions, we were proposing to add that line. And now we're requesting the board to remove that line and just to keep it exactly as it currently is in the regulation.
I just wanted to make sure that I understood. Thank you.
Yeah, I apologize. It was kind of difficult to be able to illustrate, changes and deletions that were made prior to and before. So, but that's anything that's red, underlined, and struck through. That was new language we're proposing, and now we're asking to go ahead and remove it so it's still the same as it is currently.
Thank you.
Next slide, please. So the table, the next section is that we're proposing is some footnotes that are in section 403.1. And as I've mentioned, we've received requests from the community. As the board may recall, when we did the public comment period for the past revisions, we received comments from community and business to allow more flexibility on allowing single user and family bathrooms. And as I stated before, under state law, we're required to meet the minimum requirements for the IPC. Now, and as I mentioned, some of the department's regulations are more stringent with regard to the fixture requirements, which gives us the flexibility on the use of those fixtures. And when I say fixtures, I'm talking about, layman's terms of, toilets and that type, basically bathrooms. Now, the first change is to footnote number 14. And this is language that some of that we already have, and this is an area where we're a little more stringent, and it requires that that based on what the table AC 403.1 is, I should mention, is a table that says that based on your occupancy, tells you how many bathrooms you're required to have based on your how many you're allowed into it. So if you're a restaurant, it'll say you need to have, if you have an occupancy limit of 200, it'll say you have to how many bathrooms you're required to have. And so within that, we had an exception, which is for A2, and A2 is would be nightclubs, bars, restaurants, banquet halls. And what it said was that if you have an A2 occupancy, so if you have a restaurant and you're required to have 8 or more male or female bathrooms, essentially, you are required to have a family assisted or assisted use bathroom. What we're allowing to flex, since this is a requirement that's more stringent than the IPC, we are also giving more flexibility to allow business the option to also allow for a single user toilet room when they're required to have that additional use there. And we're also including language related to those types of single user or family may be identified as being available for use by all persons regardless of their sex. Now, number 21 is an additional exception which we're adding. And this is really getting to what I said, and I apologize multiple times about our ability to be more stringent. What this says is that if our fixture requirement for an occupancy exceeds the state's IPC fixture requirement, and I'll illustrate on the next slide to make it a little easier to understand that, then that business has the flexibility to use that additional fixture for either single user, family bathroom, or single or assisted use bathroom. The next slide, please. And so this chart really is helpful in explaining that. And what you'll see is this is an example of a business occupancy. Now, business, which would be, as a transaction of business, professional services, and so forth. What you'll see in the chart is that IPC 2015 has a requirement for a number of male and female bathrooms based on the occupant load. So if you have, for example, a 50 occupant load, you have to have 1 male and 1 female bathroom. Our regulations, current regulations under Article 15 would require in that same occupant load 2 male and 2 female. So as you see in the chart, our number of bathrooms exceeds the IPC by 2. So what we're allowing a business to do is they have the option, if they want, to use those 2 additional bathrooms for either a single user, a family bathroom, or an assisted use bathroom. So we're giving the businesses the option to provide some flexibility. Next slide, please. And the next slide, the next change is to 403.1.2. And this is language, so the IPC currently allows occupancy and mercantile occupancies to use family or assisted bathrooms to count towards their fixture count. Now, this section does not include a signage requirement, meaning that it doesn't specify how that's the signage requirement for those types of for family or assisted use. Now, there is another section in the IPC that deals with family bathrooms and states that these family bathrooms and assisted use bathrooms are not required to be identified by, identified exclusive use by either sex. So what we're doing is taking the language that's already in the IPC as the one sections relating to family bathrooms. We're taking that and we're going to inserting into 403.1.2 to make it clear that family and assisted use bathrooms do not need to use, do not need to have signs indicating exclusive use by either sex. So those are the 4 changes that we're proposing from what the board had already voted on back in November. So what we're requesting is that the board approve a public comment period for those 4 proposed regulation changes.
Jeff, can I ask a question again? Just
Sure.
Bill Youngblood. Is this for going forward, or is this retroactive to every bathroom in Allegheny County?
So this would be what the code would require. So if the code requires, you know, 5, you know, if there's additional bathrooms that exceed what's in the IPC, then they would have the opportunity to, if they would want to convert some of those to single user or family bathrooms.
Well, I'm just looking at the numbers. I guess the concern that I have is that some of the older restaurants, et cetera, are not going to have the ability to do that if they're small enough. And so this means we're going to force everybody to go backwards in time.
No.
That's what I was asking.
No, I'm sorry. This is purely an option for the business. If the business is not required to install these additional ones, if they already have the fixture requirements, this is an option for them to do it. So there would not be required for them, older business, to make any changes, as long as they're meeting the fixture requirement.
If they're renovating their facility, then they can do this. It's not like they're going to be required to do this. And I guess the other thing is you're just asking for the sex or whatever it is be taken off the single use occupancy or whatever bathrooms, and they'll be gender neutral.
Right, for the single use.
I understand. Okay. Right. I just wanted to make sure, because I've had a lot of questions on this, given the fact that, you know, I'm in that business.
And these are requirements. These are options to give businesses the flexibility.
Appreciate that. Thank you. Just wanted to clarify.
So just to be clear, they could designate it as a gender specific, but they don't have to. Is that
right?
Basically it?
So there are requirements now will say how many male or female they're required to have. If our requirements are required that they have more than what's under the IPC, then they have the option to designate them as single user, family restrooms, assisted use, and they for that purpose. And the signage could reflect that.
Great, thanks. Any other questions, comments?
Yeah. In reading this, so you know, when I was reading it, I think I took a slightly different perspective on it. First of all, I appreciate this and the efforts to make these changes more inclusive. And you know, I know there were a number of public comments on this issue. So my question is, it's actually on this. So they have the option to do it, but to create signage or facilities that are gender neutral, but that also means they have the option not to. And I feel like that's, you know, if these are facilities that are in exceedance of the requirements, there's actually, I think, a few good reasons why we would want to have those then be gender neutral facilities.
I mean, to be honest, I don't understand why, if you have a single user bathroom, why you would just making it gender non-specific gives you maximum flexibility. Seems to me a bit of a no-brainer to me, but maybe I'm missing something.
Exactly. And when I read it, I had the thought, it's like, you know, there's a lot of, you may designate these facilities, these single-use facilities, in a gender-neutral way, but I mean, I don't understand why it isn't just you shall designate these facilities in a gender-neutral way.
So one of the questions I have is, if you have to make them gender-neutral, you need to make provisions from sealing the wall stalls. Is that correct?
Well, these would be single user under the single user. And I know Ivo and Jim Kelly are on. They might be able to answer that a little bit better.
These will be single user bathrooms. They'll just be just like a single use bathroom. What is in use today? If you go into a small establishment, they might have one single use men and one single use women. What we're proposing that they don't have to label those bathrooms. They could have it just as single use and not have a men's and women's for the extra bathrooms.
So only one person
because it's
in that bathroom at a time, correct?
Right. There will only be one person in that bathroom at a time, correct?
That's
you don't
what
have
I
people need to stall then. Okay, any other questions, comments? All right, good discussion.
Dr. Harrison, I know Carolyn Mitchell. I don't know if did she have any comments or questions?
I think I heard her just trying to speak.
Yeah, I had wanted to add that I think that this really needs a lot of public comment and a lot of input. And there are some community groups and, for instance, the universities, the person in charge of construction, the vice president for Carnegie Mellon. I'm sure that if we reach out to those groups and invite them, we will have a much more robust proposal on which to vote later on. So I'm all in favor of putting it out for public comment and also inviting the interested groups to participate fully, not just send in a 2-paragraph public comment, but actually meet with the folks at the board who are doing the work on this and give their input, because we've had some very valuable comments here.
Caroline, are you anticipating specific concerns, or you're just speaking sort of generically?
No, I'm speaking generically because we've seen a lot of public support for proposals to increase the number of single-user bathrooms. The American Institute of Architects is proposing that all single-use bathrooms need to meet the European floor-to-ceiling standards, but nobody seems to be agreeing with them at present on that. So the ideas that we have here certainly look like they could be accomplished, and I just would like to reach out to members of the community who've expressed a great interest in this.
Great, thanks. Any other discussion before we?
Yeah, Lee, it's Edie. I just had a comment or a question. I want to, I'm resonating with Joylette's comment, noting that we are simply allowing establishments to make bathrooms gender neutral should they choose to do so. But should we not consider encouraging them to do so in some fashion? Does anybody want to comment on that?
I already commented on that, so I'm in agreement with that suggestion.
I'm just trying to think of the thought process for a restaurant, for example, to not want to have the flexibility. You know, whoever shows up can just go in since it's single use. But yeah, well, I guess we'll see what we get in terms of public comment.
Well, and I think that my understanding, right, is that we're only able to modify this in cases where we're more stringent. So this would only apply to single-use facilities that go beyond the prescripted 2015 gender-specific facilities. So it seems like it's not a really problematic ask, since this is already, you know, single-use facilities that we've already asked for them to exist. It's not like people are creating whole new ones.
Right. I'm just thinking of the times that I've been, you know, in a single use that's designated female and it's empty, but I can't go in, and the male one is being used. So again, it just allows for maximal sort of flow, if you will.
Yeah, and there were some there was some good feedback, and I can remember it being not my turn to do a diaper change, but there's no facilities in the male restroom, so it's my turn anyway. There are lots of, I think, there are so many instances where this would be more inclusive and better.
Yeah, I'm guessing most businesses will recognize that. I'm hoping anyway. Okay, additional discussion. So can I have a motion to submit the proposed revisions to Article 15 for public comment?
I move to submit the proposed revisions for public comment. This is Caroline Mitchell.
Second, please.
This is Edie. I second.
Okay, additional discussion. Okay, all in favor? Aye.
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 Opposed? Abstentions? Okay, thanks very much. So Mr. Otis Pitts is going to be talking about paid sick leave. Otis, take it away, please.
Thank you, Dr. Harrison. Today, I have the honor of introducing a new proposal that would create a brand new Article 24 in the department's Code of Regulations and establish a new requirement for certain employers to make paid sick leave available to employees in workplaces throughout the county. As with our other regulations, we'll be asking the board to approve putting this new regulation out for a 30-day public comment period to elicit feedback. And before we ask the board to get to a vote on this, I'll be providing some background related to the public health rationale for paid sick leave, or earned sick leave as it's referred to sometimes, and also outline how paid sick leave would be accessed by workers under this new policy. And here I should also note that if Allegheny County were to enact a form of paid sick leave, we would join 16 states, 29 cities, and 3 other county governments in adopting this important policy. Just as FYI, those other county governments include Cook County, Illinois, Montgomery County, Maryland, and Westchester County, New York. Next slide. As the board is very well aware, many factors contribute to individual health, and the health department is very excited to have this opportunity to underscore the importance of policies like paid sick leave that shape everyday life for Allegheny County residents. We believe that enacting this new Article 24 will position individuals and families throughout the county for better health outcomes. Also, as the COVID pandemic has brought to light, those who work on the front lines in service settings like restaurants, nursing homes, and childcare often have the greatest exposure and interaction with the public, yet these same positions do not typically have access to paid sick leave. As the lead agency for the county's COVID response, this is something we've witnessed firsthand, as countless individuals that we've engaged during case investigations and contact tracing have expressed just a reluctance to comply with isolation orders or quarantine orders because they literally cannot afford to call out of work. A county paid sick leave policy would go a long way in positioning more of these workers for access to this critical benefit. And before we get into the details of the actual regulation, I'll take a moment just to highlight some of the supporting data and policy endorsements from leading public health organizations. First, paid sick leave has been supported by the National Association of City and County Health Officials, NACCHO, for almost 10 years as a policy that is essential to well-being and has a positive health and economic impact on communities. In its support of paid sick leave, NACCHO has noted that offering paid sick leave is highly likely to increase the number of workers taking needed leave to care for themselves, receive preventive care, or care for ill children or dependents. APHA, the American Public Health Association, is also on record supporting paid sick leave, going back to 2013 as a policy approach that protects against the spread of infectious disease and also improves the situation of those in low-wage jobs who, in the words of APHA, should not be forced to decide between staying at home to recover or go to work since they cannot afford a smaller paycheck. According to a 2016 report from Health Affairs, workers without paid sick leave are 3 times more likely to forego medical care when ill or injured for themselves and 1.6 times more likely to forego medical care for loved ones. Paid sick leave also has a tremendous impact on how and when people engage the healthcare system. According to a 2018 report from the National Partnership for Women and Families, employees without paid sick leave are more than twice as likely to use emergency services compared to those with paid sick leave, and often use these costly urgent care services rather than seeking preventive care. Next slide. And so before we get to some of the details in this proposed Article 24, I'll take a moment just to remind the board of its authority to promulgate a measure like paid sick leave. And I'll defer to Jeff Bailey on any specifics here, but this paid sick leave rule is in line with the board's authority laid out in Act 315, also known as the Pennsylvania Local Health Admin Law. And as you'll see on this particular slide, this language establishes the board's power to pass regulations for the prevention of disease, the prevention of conditions which constitute a menace to health, and for the promotion and preservation of general public health. And as stated in the draft authority and purpose section in the draft before the board on page 1, it's our position that paid sick leave or paid sick time will prevent and control the transmission of illness among coworkers in Allegheny County, and also allow employees and their families time to recover from health conditions and ultimately reduce the likelihood of severe illness or injury. Next slide, please. So getting to the actual regulation, if this proposal is enacted, what would it look like and how would employees throughout the county access this benefit? In some pretty broad strokes here, under this proposal, employees that work for employers with 26 or more employees will accrue at least 1 hour of paid sick leave for every 35 hours worked. Employees would be able to accrue a balance of 40 hours of paid sick leave unless their employer has a policy explicitly allowing more. Employees could also use that time in 1 hour increments unless their employer has a policy allowing smaller increments than 1 hour. And perhaps most importantly here, I should note the conditions or situations when paid sick leave would be expressly allowed and authorized under this proposed Article 24. Under this article, a worker could use paid sick leave for their own or their family members' mental or physical illness, injury, or health condition, need for a medical diagnosis, care or treatment of physical illness, injury, or health condition. Also, the employees or the employee's family members need for preventive medical care. The definition of family member, by the way, can be found on page 2 of the draft.
Can I ask a question at this point?
Sure. Sorry, Dr. Harrison, go ahead.
I just want to make sure I understand the 26. So if you have, as an example, a McDonald's franchise that has 15 employees, is it the 15 or is it the McDonald's is an enormous, organization with tens of thousands of employees?
It's for that particular.
You see what I'm asking?
It's for that particular workplace.
I see. Okay. Thank you.
Otis, if I can follow up on that question.
Sure.
I haven't been able to find out where the number 26 came from as a breakpoint. I don't know if it's good or bad, but where did that come from?
That's a great question. Obviously, as a public health initiative, we want to reach as many folks as possible with this, but we're also very mindful of the impact on the broader community. And it's no secret that this policy has been debated at the city level, also at the county level. So we have used some of those parameters from the city and county proceedings to inform this proposal.
Well, okay, so we don't know where it came from is what we're saying. And at this point, somebody just didn't pluck it out of the air, I guess is what I'm asking. I don't know if it's too many or not enough, but go ahead, I won't interrupt you.
And that's a great point, and we look forward to, yes.
By its nature, it seems somewhat arbitrary.
Yeah,
Go ahead, Tony.
Could we dig into the facts of knowing, like, not just pick on the hospitality for just a second. If we know how many the average of every restaurant and bar or hotel or just a segment looking at it, I mean, if there are 5,700 licenses, what is the average? What is the head count employed by each of them? That would at least give us something to look at.
And that's a great point. And we're actually in talks with our county partners. For instance, the Office of Economic Development, to get a better sense of just how many employers would be covered by this policy and how many employees would also be covered. So this is information we're currently gathering.
Yeah, and the idea is that you don't want people with hepatitis A or COVID or, Salmonella, E. coli, whatever, to be working and infecting, putting the public in danger. So that's where the 26 really does seem arbitrary, because you could have somebody not covered who just feels pressured, working for a very small place, to come in with hepatitis A. And there's lots of examples of, food industry workers causing outbreaks.
Yeah, my concern was,
you could have a hardware store that has 4 people working.
My concern with just the number, and I don't know what the number should or shouldn't be, and I am in favor of the proposal, but the question is, if I'm an employer, and why would I hire 26 people or 28 people if I have to cover sick time? Why, when I just keep it at 25? That's the downside of what I think the number is. So that's the only reason I'm asking the question.
Tony, were you saying something?
No, I was just about to say something.
I'm sorry, go ahead. Enjoy that.
Oh, okay. Yeah, not to, well, to add to the conversation too, I mean, I think that I agree. I figuring out what that number is and who that actually covers, I think is useful for us to know, even if, I'm absolutely supportive of moving in this direction, but I think it's helpful for us to understand how many people this is affecting from an equity standpoint. What's the percentage of the low-wage workers that were mentioned a minute ago that are actually covered by this? How does this actually, where does this get us in terms of solving the problem? And had some of the same thoughts that I think Bill was just raising too, about what are the, does this create a strange incentive process or disincentive process for employers?
Let me also point out, we have some federal guidance on coverage here. For example, the Equal Employment Opportunity Commission only covers employers with at least 15 employees. And they also look at how many hours a part-time employee has worked for purposes of figuring out how many employees there are. I have some concerns about setting the number at 26, which seems awfully high. I also have some concerns as to what do we do about a part-time employee operation, where if they know that they have to provide paid sick leave over 20 hours a week, suddenly everybody starts working 18 hours a week. I mean, that type of evasion is very common in the wage and hour and the equal employment opportunity cases.
Yeah, so I'm also very much in favor of this, but it's a huge sieve in terms of lots of opportunities that would not be covered for employees to feel pressured to work. Again, and I can just envision a kitchen worker with eyes as red as as yellow as a school bus because of hepatitis A, who's not covered here. So I don't know, this moving through, I just wonder if there's a way to catch some of those situations in addition, without being overly onerous on the smaller businesses. But I think it's a huge loophole in terms of potentially ill employees working and endangering the public.
So I'm just going to comment. This is going out for public comment, which will hopefully will get a robust response from the public, from all different groups, that we can really consider all of these really important questions in the regulations.
Okay, Otis, you want to keep going?
Yeah. Thank you, Dr. Harrison. So just very quickly, some other conditions that I wanted to cover that would be expressly approved under this policy. In the event of the closure of an employee's place of work due to a public health emergency, such as COVID, that time would be covered by paid sick leave. And also paid sick leave would be authorized for an employee's need to care for a child whose school or place of care has been closed due to a similar public health emergency, like what we've just seen this past year. Todd, if you could make it to slide 5 for me very quickly. And I think this might address some of the points that were just brought up, but This draft also includes measures to protect employees that believe they are not able to exercise their paid sick leave rights or have otherwise been unfairly treated as a result of trying to access their paid sick leave. For instance, under this proposal, it shall be unlawful for an employer's absence control policy to count the use of paid sick leave in a manner that leads to discipline or other adverse actions for the employee. Employees that believe they've experienced unfair treatment under this code as a result of exercising these new paid sick leave rights would be able to pursue a course of action, including an investigation, by filing a complaint with Allegheny County. Last slide, please. So in terms of next steps here, we're asking the board for their support in putting this out for public comments for a 30-day public comment period, which would also include a public hearing towards the end of that 30-day window. If we do receive a vote in favor of public comment, we'll look forward to gathering much of the information that was just discussed, as well as the public responses, and reporting back to you in the near future. Thank you.
Otis, I do have one more question. You were saying that somebody, if they feel they've been mistreated under this code, could file a complaint with Allegheny County. Who would you file it with? The health department, the county itself?
And that's a great question. And as part of drafting this, we did a national scan of various jurisdictions, state level, county level, city level, and found a lot of examples to kind of build in here, a lot of example language to build in. And one thing that we thought was attractive that some jurisdictions use is building in some flexibility for the chief executive, the mayor, the county executive to act at their discretion, to assign this work and this oversight to agencies as they see fit.
Well, thank you, because I'm sure the county council will have the same questions as who's going to administer this, basically. But thank you.
This is Don. A comment. In 2013, our group at the University of Pittsburgh published a paper in the American Journal of Public Health that was a model of Allegheny County and the effect of paid sick days on influenza transmission in the county. That it looked at workplace sizes, but not specifically 26. The paper broke it into workplace sizes 0 to 50, 50 to 100, I think. And it in the model showed the likely reduction of transmission of influenza in the model. So one thing you might consider is using a computational modeling approach to address these questions, particularly since there's one that's already been published. This article was referenced in the New York Times editorial at the beginning of the COVID epidemic as the kind of example of the way to think about the influence of paid sick day policies. I'd be happy to help if there's interest.
Thank you, Don.
Thank you, Dr. Burke.
Any other comment before we go to a vote? Okay, can I have a motion, please?
So moved.
Take this to public comment. Okay, thank you, Tony. Second?
It's Edie, second.
Thank you. Any additional discussion? All in favor? Aye.
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 Opposed? Abstentions? Okay, thank you very much.
So just to be clear, I think it was Bill Youngblood who put the motion forward, correct, Bill?
Yes, it was. Thank you.
Okay, so we're going to move to the non-agenda item of public comments. Todd?
Okay. I will now summarize the public comments on non-agenda items. The Board of Health received 14 comments on non-agenda items. There were 11 comments expressing concern regarding the recent fire at Metallico and its impact on air quality in the immediate vicinity. Of those comments, 5 expressed a desire for improved notification to the public of fires, and 6 expressed a general concern about the operations of Metallico itself. 3 additional commenters expressed general concerns regarding air quality in Allegheny County. 2 of these commenters called for stronger fines or enforcement of regulations. One commenter described the work of U.S. Steel and the importance of permanently idling coke batteries 1, 2, and 3 at the Clairton Coke Works. And that's the end of the summary.
Thank you. So just to be clear, all of the public comments will be posted on the website. Is that right? The full text?
Yes.
Okay. All right. Before we adjourn, any other questions, comments, discussion? Okay. Can I have a motion for adjournment, please?
This is Bill Youngblood, so moved.
Thanks, Bill. Second?
Second.
This is Tony, I'll second.
Okay. We have several seconds. Thank you. Okay. All in favor?
Aye.
Aye. Okay. Thanks, everybody. Bye-bye.
Thanks, Lee. Talk to you later.
Bye.
Bye-bye.
Thank you, everyone. That does conclude the Allegheny County Board of Health meeting for May 5th, 2021. The next meeting of the Board of Health will be Wednesday, July 14th, 2021. Thank you again for joining us.